RH incompatibility. What is RH incompatibility? It's a condition that occurs during pregnancy if a woman has RH negative blood and her baby has RH positive. An example of this could be an A- mom who has an A positive baby. The A positive baby, although they're both type A, has the RH protein attached to the red blood cells. And the A negative mom does not have the RH protein, which makes her RH negative. So the fetus's blood somehow crosses into the maternal circulation, which causes maternal immune system to produce antibodies against the foreign fetal red blood cells, which contain that RH factor or protein that the maternal red blood cells do not. This can lead to the destruction of the fetal red blood cells when the maternal RH antibodies attack the fetal red blood cells that have the RH factor. Maternal and fetal circulation do not mix. Their blood meets at the placenta, but it never crosses. And the first exposure is usually during the birth of the first child. So this is the picture just to help illustrate what goes on during the first pregnancy. The RH negative mother, red blood cells, and then you have the RH positive fetus red blood cells coming in contact with the mom's circulation. So the mom's cells recognize it as foreign and then create antibodies against it, against the RH positive red blood cells. And so nothing really happens with the first pregnancy, but the subsequent pregnancies, the maternal body, if it has the antibodies present, that's when the future pregnancies have a higher risk for red blood cell destruction. And so this is the picture of what happens in the second exposure or following pregnancies. The mom's immune system recognizes the antigen or the RH positive red blood cells and produce large number of antibodies that attack the red blood cells and mark them for destruction. So the fetal red blood cells are destroyed by the maternal antibodies, and that causes the red blood cells to lyse, and when they rupture open, it frees bilirubin. The placenta usually can clear the bilirubin, but in extreme cases, the bilirubin level increases greatly, and the babies are born jaundiced. The fetus can compensate for the anemia by producing large number of immature red blood cells, and that's a condition called erythroblastosis fetalis. So there's a test called the indirect Coombs test, which is done only for type negative moms, so RH negative women at 26 to 28 weeks, to detect if the mom carries any antibodies against the RH positive red blood cells. And this is to protect the baby. And you always assume with an RH negative mom that the baby she's carrying is going to be, you treat it as if the baby were RH positive. So the maternal blood in the indirect Coombs test, the maternal blood serum is mixed with RH positive red blood cells, and if clumping of the RH positive red blood cells happens, then that's a positive Coombs test. And a negative Coombs test would mean that the mother has not created the antibodies against the Rh positive red blood cells. And so in that case, if the Coombs test is negative, you want to prevent the mom from forming these antibodies. And so the mother receives a prophylactic dose of RhoGAM to prevent antibody formation. And this is the cloaking medicine Dr. JBT was talking about. RhoGAM prevents the mother from producing antibodies against the positive blood type. It's 90% effective, and the times it's recommended to give RhoGAM to negative, Rh negative moms are at 28 weeks of gestation with a negative Coombs test, with bleeding after an invasive procedure, or within 72 hours after delivery. And this is all instances where there is a possibility of the fetal and maternal circulation coming in contact with each other. And that's all.